everyone. Welcome to Office Hours. Thank you so much for tuning in. Our special guest today is Musely Dermatologist Dr. Ravi Ubriani. He graduated from the University of Pennsylvania School of Medicine. Today, we're going to be talking about hair loss. So very excited to have him sharing some context about that.
Our first question is from Cindy H. So she asked, how can I properly diagnose the cause of my hair changes and hair loss?
Yeah, that's a great question. Hair loss is complex. There's lots of different factors and reasons why you can have your hair fall out. With a teledermatology platform, we're working most off of history and off of the appearance and the photos. So the better photos really help us make an accurate diagnosis and giving us a good history of exactly how long the hair loss has been going on for, what were the contributing factors can be really helpful. In some situations where the hair loss seems slightly different from the typical patterns, we would recommend additional blood work, lab work, or even a biopsy of the scalp. But those would be done in an office and couldn't be done virtually, obviously. But the vast majority of times we can diagnose based on the pattern of hair loss, the photos, and a good history explaining how long the hair loss has been going on for. And it's very important to have a good diagnosis because that's how you get the most effective treatment.
And so for those patients like Maylin F, who's experiencing hair loss and are struggling with that and wanting to find solutions, how can they stop the hair loss immediately and maybe long-term as well?
Yeah, so, so let's, you can hear even in that question, just the stress of hair loss. Like hair loss is a very stressful event. And so a lot of people really feel just overwhelmed with it, or it really does affect their well-being. And so, it's very important to kind of have a plan to make that better short-term and know what to do short-term, and then understand that some of these treatments take a while to take effect. And so having a good game plan in place. So the most important thing, first of all, is to treat the underlying cause if there is one. So if somebody's underlying cause is very clear and there's a clear trigger for it, removing that underlying cause is very effective. But a lot of times the cause has already left, or the cause is something that even if you treat it, you kind of have to still wait for the long-term implications. Choosing the right treatments and getting that going is the most effective thing. One thing sometimes people often ask is, they tell us, well, I stopped shampooing my hair entirely. So I'm not shampooing whatsoever. I'm not touching my hair. I'm not brushing my hair. And that I often tell them, that's not going to help. If your hair is in a situation where it's falling out, those hairs are destined to fall out until some new hair is growing. So if you are destined to lose 100 hairs every day, and you say, I'm only going to touch my head every 7th day, you will lose 700 hairs on that 7th day. And so that's just the way it works. You can't keep the hair inside your scalp by not washing it or not brushing it. So keep up with whatever your typical routine is, and don't feel stressed about that. There are exceptions, but in general, typical hair care is not going to cause any major problems there.
Well, I've noticed that I have a lot of growth, and I've been using it. I think this is like my 3rd month. And I was just wondering, is it something that you have to continue to use, or just what is the maintenance of it, of keeping the new growth?
Hi, Renita. I think that's a great question. So it really depends again. So on what is the reason behind the hair loss? A classic reason is something called telogen effluvium. So if you have a very stressful event, a high fever, or you're very sick, or something you have surgery, or something very stressful happens, that can send your hair into kind of a shedding cycle. So what happens there is people will be very sick, and then a few months later, they'll notice that all their hair is falling out. If you did nothing, the hair would slowly restore its balance over many, many, many months. And so in that situation, the treatment is really only needed for about 6 months or so. That just accelerates that regrowth of hair, and then your body kind of restores its equilibrium. Another type would be androgenetic alopecia, which in a man will make them kind of go bald in a typical pattern. In a woman will cause more thinning, like generalized thinning. And that's a lifelong condition. So if you have that situation, you really do have to use these treatments forever. It's not that things will rebound or anything, but if you stop, you'll go back to where you would have been before. So you kind of have to keep using that treatment indefinitely. And sometimes there's overlap. And so sometimes what we do is when people have been regrowing their hair really well and they're 6 months in, I let them give a trial. I say, you can try stopping it now. You're not going to do yourself any harm. If if the hair starts falling out again, then this is probably a long-term thing for you. And if it stays, then great. You don't have to keep doing this. We always want to try to minimize that kind of indefinite medication if we can. But some people do have to use it forever.
Okay. And one other question I have too. I heard that if you're on high blood pressure medicine, that can cause thinning. And I am on it and have been on it for years.
I can't give you specific medical advice, but the opposite is true. There aren't a lot of blood pressure medicines that cause hair loss specifically. Actually, we use minoxidil, which is one of the most common ingredients used for hair loss, was a blood pressure medicine. And they were giving it to people with blood pressure issues, and they realized that they were growing all this hair. And that's why it became used as a hair loss medication.
Oh, okay.
Yeah. So there are a lot of blood pressure medications. And so it's possible that in some situations, some people might notice that medicine is worsening it. But there are so many choices with blood pressure medicines that that can usually be worked around. It's not a typical thing that blood pressure medicines will cause hair loss.
Okay. Thank you.
I am planning to start the hair loss medication, and I was wondering the difference between that one and the regular biotin type of sprays that we can find over the counter. And the other thing is, like, as far as I could remember, a couple of years ago, my doctor told me that I have a male type of hair loss, and would it work on that?
So again, I'm going to keep prefacing this with, I can't give you specific medical advice, but in general, So androgenetic alopecia, or AGA, is that form that's called male pattern baldness. And I always try to reassure women that it does not make women go bald. Men go bald where they lose the hair on the top of their head and get hair on the sides. That's the classic appearance. But women tend to have more of a diffuse kind of thinning of the hair as opposed to going bald. And that by itself is very reassuring. And so, the treatments in the various options do treat that very well. It's a combination of different treatments. So some of these are over the counter, some of them are not available over the counter. And the combination is, the decision points behind it is having a lot of dermatologists who have expertise in seeing patients for a long time, kind of combine and use what they know works well in their patients into an effective formulation. So the different ingredients that can be in there are minoxidil. Minoxidil, we talked about a little bit before. It's a blood pressure medicine originally, but it was discovered that when people were on this medicine, they were growing lots of hair. So the idea came to make it a topical formulation. And so that's really at the mainstay of most hair loss treatments. And then other options, finasteride is a pill that has a lot of side effects and can't be used in everyone, but topically is considered more safe. Ketoconazole is actually an antifungal medication, but it also seems to grow hair. When people take oral ketoconazole, their hair and nails grow faster. And so that can be used. Spironolactone is a hormone blocker. So it blocks the effect, just like finasteride changes the hormone balance, spironolactone can block the effects of hormones on the scalp. And then tretinoin is a vitamin A medication that can exfoliate and also kind of encourage the growth of hair in some people. And so there's different combinations of those products that really help for topical. And then orally, spironolactone or finasteride can be used, or dutasteride or is a variant of that. Biotin is not something we offer right now. Biotin can be used. We talked about that a little bit before. Biotin seems to make hair and nails grow a little thicker in some people, more nails, but it definitely can affect. You have to have your thyroid checked. If you're ever getting any blood work and you're taking biotin, you definitely want to let the people who you're seeing know that you're taking biotin, because your lab work can be altered by that.
There were actually quite a few questions relating to the ingredients in Musely's formulations. We had one from Sheila regarding spironolactone.
Hi, curious if there's a specific recommendation for topical first versus oral spironolactone first.
That's a great question. And so this gets tricky sometimes. In general, all hair loss treatment is kind of a combination of multiple things. There's nothing that is a slam dunk, kind of hits it out of the park for anything. You have to kind of consider that each thing is going to help somewhat, and you're going to kind of get some step benefit with each thing you do. And so good nutrition might be a step, a topical supplement might be a step, an oral supplement might be necessary too. If you want to kind of hit it as hard as possible, I do recommend that both of them are used. They work more effectively when paired together.
Thank you.
I'm going to jump in with one more question from Lucy G, who was wondering about having naturally thin hair. So if you haven't necessarily experienced hair loss, but you just have pretty thin hair, could it be made thicker with any of these prescription or non-prescription solutions?
So that's a good question. So the ones that could possibly work on that, spironolactone, topically or orally, might make a difference in that. And ketoconazole might make a difference in that because it just kind of encourages thicker hair. But there isn't a lot that's going to change the actual thickness of the hair shaft. There are over-the-counter products that are electrostatic small fibers that actually kind of bond to the hair temporarily, and so can give the appearance of fullness or thickness. But those wash out, so they're temporary. It's almost like a powder that's sprinkled on the hair, and it makes the hair look thicker temporarily. There are shampoos that kind of do the same thing. They have sort of small pieces of material that are attaching themselves to the hair temporarily. There's not a lot of medical stuff beyond spironolactone and ketoconazole that I would give much weight to in terms of changing the actual thickness of the hair. Because something like minoxidil works by making, you imagine like a hair follicle being this area where hair should be growing, it can actually make that hair come back to its regular thickness, but it wouldn't make it go beyond that. It would just make it come back or start growing again or come back to where it was at baseline. But it wouldn't do anything more than that.
All right. Thank you so much, everybody, for joining. Big thank you as well to Dr. Ubriani for answering all of the questions today. But yeah, thank you so much, everyone, for coming and bringing your questions.
Bye-bye. Thanks for having us.
Thank you.
Thanks.
Bye.